vast majority of patients in this study were treated as third line or as third line or beyond, or third line treatment. So they are heavily pre-treated patients. Patients do not require to be PD-L1 positive to go into the study, although the PD-L1 expression was prospectively evaluated. So all investigators have to submit tumor upfront to be evaluated for PD-L1 expression. But they can be PD-L1 negative and go into this study. In fact, although I mentioned there was a DLT with one of the patients, but in fact for the rest of the study, this combination of Pembrolizumab and Ramucirumab was very well tolerated. There was hardly any treatment-related grade 3 toxicities, all less than 10%. You know, especially when you look at side effects related to angiogenic like hypertension, venous thromboembolisms, and all that, they were all very, very low rate, and also the toxicity related immunotherapy, you know, in terms of, you know, colitis, endocrine, all that were all observed at a very, very low incidence of less than 10%. In fact, most of the toxicity at most only got 1 or 2 patients with that toxicity. So it's really well tolerated. Now, in terms of efficacy, at the moment, because the follow-up is still very, very short, because the first patient only went in around November 2015, and the database lock for this particular presentation was in October 2016. So you can see it's a really short follow-up at the moment. Now, we observed 4 objective response, which is 10%. Well, you might say, well, you know, it does not look, you know, a lot at the moment, you know, for a 10% response rate. But what we also observe is there is a good number of patients with prolonged disease stabilization. And in fact, that is what we've seen, is that actually a lot of patients have a very long time where the disease is being stabilized. Now, the progression-free survival and the overall survival at the moment is still very immature. We're still waiting for more time follow-up before we know.